Boy, if there's one type of patient that gives dentists the most pause, in my opinion, it's gotta be the pregnant patient. If you're pregnant, trying to get pregnant, or know someone who's pregnant, then this video is for you. Well, hello again, folks, and welcome back to another Dentistry Made Simple video. My name is Dr. Kenneth Goods, and I'm a retired dentist from the state of South Carolina here in the U.S. Ah, yes, the pregnant patient. These women are constantly being given a list of do's and don'ts during their pregnancy, that it can be hard to keep track of what you can do and what you can't do. And I'm here to tell you that the dental profession often deals with our own list of do's and don'ts when it comes to the pregnant patient. Should we even work on this patient? Can we safely administer anesthetic? What if I need an x-ray? What about prescribing drugs? Are we causing undue stress on this individual? And on it goes. Now, it may be tempting for a pregnant woman to say, well, I'm just not going to the dentist at all. That's the end of that. Not so fast. You shouldn't skip the dentist just because you're pregnant. There are certain dental conditions that are actually more common while you're pregnant. Probably the most common is excessive bleeding of the gums due to hormonal changes going on in your body. In fact, we call this pregnancy gingivitis because it's so prevalent. In addition, good old morning sickness can affect the teeth because of the acidity involved with excess vomiting. In short, keep up with your regular hygiene schedule. Your dentist or hygienist may actually want to bump up the frequency of your cleanings because some studies have shown that gum disease can lead to preterm birth, but obviously that's their call. Okay, so here's the general consensus regarding dentistry and the pregnant patient from the American Dental Association, the American Pregnancy Association, along with my 30-some-odd years of clinical experience and discussion with my colleagues. First off, any sort of elective dental work or cosmetic treatments should simply be put off until the baby is born, period. No teeth whitening, no veneers, none of that. It's just not worth it. Deal with that stuff later. Second, if you need to have a cavity filled or need a crown, that's the same as a cap or a root canal, then it's best to wait until your second trimester if possible. That is, unless you're in severe pain, in which case these procedures should be performed. The logic here is that not treating the source of the pain, be it a cavity or an infection, combined with the stress and anxiety that occurs as a result, is worse for you and the fetus than the procedures themselves, regardless of which trimester you're in. Now, when it comes to x-rays, if it's needed for the emergency procedure, there's no need to worry. These are completely safe while pregnant. Routine checkup x-rays, however, should probably wait until after you have your baby. So what is it about the first trimester that is so taboo? Well, this period of time is vital for the development of the baby. Arms, legs, and feet start growing, and soon after the digestive system, eyesight, and even the sense of touch begin to develop. We don't want to do anything that could potentially cause any complications for the fetus. Furthermore, the last trimester is often avoided as well so as not to affect the delivery of the baby. Plus, leaning back in a dental chair for an extended period of time might be difficult to pull off. Look, I think much of the controversy swirling around dentistry on a pregnant patient involves science, public opinion, and risk. Science tells us that it's safe to perform dentistry on a pregnant patient. Public opinion thinks it's not a good idea, why take the chance? And risk tells the dental team, hey, I don't want to get sued if anything goes wrong with the pregnancy. So in summary, let your dentist and hygienist know if you're pregnant, postpone non-emergency dental work until the second trimester or after delivery, no elective procedures until after delivery, and keep up with your preventive exams and cleanings during your pregnancy. Deal? Well, let's wrap up today's video, folks. I hope you learned something that you didn't know before. If you enjoyed this video, would you do me the favor of hitting that like button below, as it will help this channel grow? Feel free to leave a comment or question as well. Please consider subscribing and be sure to hit that bell icon so you can be notified of future videos on dentistry made simple. Bye-bye.